Thank you for being with us this afternoon. We appreciate your time. I want to get directly to our next guest because I'm incredibly excited to speak today with Dr. Marty Makary. You know him and you've heard of him, and he's written books before, but his new one out is Blind Spots. Doctor, thank you for the time today. It's a real honor to have you back on the show with us.
Great to be with you, Annie.
I'm looking at some of the things that Blind Spots is covering, and what you're really doing is trying to upend the groupthink that takes place in all of our medical thinking, all of our novice medical thinking. There are a lot of assumptions that people make, and you're trying to call them to the forefront. Give us a highlight of how you got to the point where you wanted to put this down in words in a book to change the way people process medical attention.
Well, there's a bunch of giant areas in medical science that we don't traditionally talk about in hospitals, and that is gut health and the microbiome, our poison food supply, ultra-processed foods, the role of pesticides and seed oils. These are things that relate to every aspect of American health, and so people need to know the truth. So a bunch of us as doctors now are trying to go directly to the public to educate them, because these are not things you hear about in your typical doctor's visits. The benefits of hormone replacement therapy at the time of menopause for women are overwhelming, reducing Alzheimer's risk and cognitive decline, reducing the risk of heart attacks, and having stronger bones. So people need to know about all these topics I read about. And so that's why I wrote this book.
I appreciate that so much because, you know, one of the things that you talk a lot about is gut health, and I want to start with that. So many women, I'm 40, I've had 4 kids, and so many women my age are dealing with gut issues. A lot of them are trying to figure out ways to, stay in shape, to make sure they maintain their weight, and they're trying to maintain their lifestyles as well. And there's always a lot of convenience things offered that you can invest in to try to help you along that way. But gut health seems to be such a problem. And I have dear friends of mine who are basically my age who have died of colon cancer at such a young age before they even recommend that you go get your colonoscopy. Tell us what we have been thinking about gut health and where we should be shifting our focus.
Well, new research is showing that gut health is central to everything. So we call it the microbiome. We're talking about the different bacteria that normally live in the gut, that normally line the intestine. These are millions of different bacteria that live in a harmony, and they're involved in digestion. They train the immune system. They make serotonin, involved in mood. And when it's out of balance, when we mess with it, it can cause inflammation. And that's one of the reasons we think colon cancer is going up in young people. You've heard about colon cancer going up in young people. One study found colon cancer is higher in people that were born by C-section, which we know changes the microbiome. Antibiotics change the microbiome. Now, both can save lives. C-sections can save lives, but they're both massively overused. So when you hear someone say, I'm taking an antibiotic, or I want to take an antibiotic, there's no downsides. No, it alters the microbiome. And when kids take antibiotics they don't need, the kids are more obese. It's something they've noticed in animals for a long time on farms. When you give animals antibiotics, they're fatter, and that's because it changes their microbiome. So we need to preserve healthy microbiomes, eat good whole foods, avoid seed oils and pesticides. If pesticides kill pests, what do you think they're doing to the bacteria in the microbiome?
Right. Yeah, destroying it.
Dr. Marty, this is Ryan Wiggins. I just wonder what, the things that you're saying, they don't sound revolutionary to me, yet you're up against a lot. Why is it that you seem to be somebody who people are saying, well, I'm gonna push back on that? What are the systems that are in place that are resistant to hearing what you have to say?
Well, there's a lot of groupthink. It's in medicine, but it's in society in general, and it's just permeated medicine. Take vaccines, for example. Vaccines are important. They save lives. Most of them are very crucial. But if we could took 1% of our enthusiasm as a medical profession, of the absolutism by which we talk about vaccines, and talked about our poison food supply, it's like unheard of. We never heard about obesity during the pandemic. We don't talk about certain things like gut health, and that's just because of the group think. Doctors are not bad people. I think we've done a terrible thing to doctors in America. We've told them to focus on billing and coding in short visits, and we have not given them the time or resources to talk about the root causes. If you ask why chronic diseases are going way up, they might say, well, it's because of obesity. Well, obesity is a symptom of a larger problem, and that is a poisoned food supply.
We're speaking with Dr. Marty Makary. He's a Johns Hopkins professor, surgeon, public health expert, and author of his new book out, which I just got on Audible right now, so you can get it wherever you get your books. It's called Blind Spots. I look forward to reading it and learning from it. How much of the solution to the problems that you pose, the things that you bring to the light in Blind Spots, how much of it is just, the reader can make those choices for themselves and can choose to live a healthier life and make healthier decisions? And how much are, average folks like myself up against a system that is making it too expensive or too impossible to be able to get healthy foods to keep their body healthy the way it needs to be?
Well, we've been fed many lies by big food, big ag, and big pharma. Big pharma has a hammerlock on American medicine and on our institutions, medical schools, and even the regulators. And the reality is we've got the most over-medicated population in the history of the world when we can be making better decisions. And a lot of the information we give people is wrong. Doctors have been telling patients for 60 years to avoid fat, to eat low-fat foods. Well, I go through in the book Blind Spots why that was wrong advice, and it still looms large today. We can prevent our peanut allergy epidemic by introducing a little peanut butter when children are 5 or 6 months of age, in infancy. The modern-day peanut allergy epidemic was ignited by the medical establishment giving wrong advice on peanut avoidance in the first 3 years of life. Hormone therapy. So there's a lot of things people need to know about that we're not talking about in medicine that we should be talking about. Maybe we need to treat more diabetes with cooking classes instead of just throwing insulin at people. Maybe we need to treat more high blood pressure by talking about sleep quality, not just throwing meds at people. And maybe we need to talk about school lunch programs, not just putting every overweight kid on Ozempic.
I hear in a lot of what you're calling to the forefront here, Dr. Makary with us right now, is that there are a lot of quick fixes that are being sold to the American people. And the quick fixes are not actually fixing the problem, not even quickly or even at all. Is it a capitalistic mentality that's hurting Americans' ability to make good decisions? Are there policies that need to be changed at a governmental level?
Well, we need to do a lot of things. First of all, we need to get rid of all the corruption. All these so-called experts that are conflicted, they're getting paid off by the industry. We've got to deal with the subsidies that make a lot of these bad foods so cheap, and that's why they use them in the ultra-processed world. 10 to 20% of the calories that we take in our diet today in America are from seed oil derivatives. They sound healthy, like vegetable oil, but it's not. It's denatured, and it's turned into a chemical. People should be cooking with extra virgin olive oil and avocado oil and coconut oil. So people need to know the truth for their own day-to-day decisions, and we need some big policy changes as well at a federal level.
Dr. Makary, I apologize if this is a question that you answer a lot, but as a novice, I hear these words like the food supply is poisoned. And I just wonder, is there a brief explanation you can give to somebody like me who is just kind of learning this to understand that when we hear that phrase, what that means?
Sure. Well, we have 1,000 ingredients in our food supply that have been banned in Europe and Canada. Kellogg's makes 2 versions of Fruit Loops, one for the U.S. with all kinds of chemicals, and one for Canada where they don't allow those chemicals. We take bread, for example. We strip it of its fiber and then chop it up into pieces that's so small, it's basically functioning like sugar. Refined flour is often turned into sugar. And we wonder why kids are not paying attention after their school lunches. We wonder why we're ushering in this epidemic where half of our nation's children are obese or overweight. It wasn't true just a generation ago. It's Only 3% of children in Japan are obese or overweight. A pediatrician would rarely see a case of type 2 diabetes one generation ago. Now, 1 in 3 kids born today will go on to have diabetes or pre-diabetes. So we've got to stop and ask, what are we doing? And that's something that we've not been willing to do. We have a food supply that was built for food insecurity. Make it as cheap as possible for mass production. Well, what we're realizing is we just got the sickest population in the history of the world. We can't just keep medicating everybody. Mm-hmm. We need to realize the cost of creating all these sicknesses. Because when you put a lot of the chemicals down somebody's GI tract, what's happening is their body is reacting, and it's making them feel sick. Their bodies are reacting at the level of the intestine with an inflammatory response. Not a giant acute inflammatory response when you eat these chemicals, a low-grade inflammatory response, making people feel blah. They feel sick. And we can't just keep medicating all these kids.
Yeah. I relate to all of this so much, and I can't wait to read Blind Spots by Dr. Marty Makary. We really appreciate your time today. We might ask you to come back again and talk a little bit more about the book and keep informing people about these things, kind of breaking the norms as to how we feel and think about our own medical care, but just our general health decisions in the first place. Doctor, thank you for being with us today. It's a pleasure to have you here.
Thanks for having me. Thanks so much.
Of course. We appreciate you.